Please welcome Heidi Raymond. Heidi. Now, Heidi, tell us your story.
I was diagnosed 5 years ago when I was 35. I found a small lump in my right breast. I went to the doctors immediately, and within 3 weeks I had a mastectomy and underwent radiotherapy and hormone therapy for 5 years. I waited a year till I had reconstruction, and I was absolutely over the moon with it. But unfortunately, my cancer came back into my chest muscle a year later. But then I had the joy of having another reconstruction a year later and feeling like I do now, really.
And now you're fine?
Yeah.
Wonderful.
Yeah.
Dirk, this is something that people, you know, Jill's thinking about it too, about reconstruction. What does it involve?
Exactly. We have basically two major types of breast reconstruction. One case is we can use breast implants. It's the most simple procedure, and usually is just involved if you want to reconstruct a smaller breast.
Yeah.
The other possibility is that what she chose is to use own tissue of the patient.
So it's tissue from whereabouts on the body?
Tissue can be taken, we talk about fat, skin and muscle. It can be taken from the back. In her case, it was taken from the back and it left her a scar. Maybe I can show that to the patient, to the audience.
So can we see that? It's hardly...
It's that.
Yeah.
And they built in combination with the breast.
Don't worry about the microphone.
In combination with an implant, they built an amazing breast. And I've seen before the show her, she told me the breast, it's stunning. Yeah. 3 months after the breast reconstruction, they tattooed and reconstructed her nipple.
Yeah.
It is really amazing. Symmetry is there. I'm stunned.
And this mattered a lot to you, Heidi, clearly. So
yeah,
your femininity,
I think in the days that were quite low, to have some hope of knowing that, although everybody else could see me looking normally, to me, I knew.
One thing, because really, she looked stunning. She really, I'm very thrilled with her result. Yeah. This is the message today of the show. Medicine is so advanced today that we really can fight cancer. Yeah. The surgery, everything is great. But most important is, again, Anita said it, early diagnosis, and women out there, look for a lump almost each day, each week, on a regular basis, and then we can have this result, this patient here.
Lovely story there, and great. Thank you, Jill, for being brave enough to do what you've done. It's going to listen to us all.